Hi, my name is Amanda Harris, and I am a rising senior in the Ecology and Evolutionary Biology Department. The project I will be presenting on today was funded by the Center for Health and Wellbeing under the Global Health and Health Policy Program at Princeton University. My project, titled The Impacts of COVID-19 on Childhood Vaccination Coverage in the United States, is the first part of my senior thesis. Since the initial outbreaks of SARS-CoV-2 in the United States and the subsequent declaration of a national emergency on March 13, 2020, all 50 states have implemented non-pharmaceutical interventions, also known as NPIs, like stay-at-home orders and shelter-in-place orders. These orders were initially made to limit the movement of people outside of their homes and to allow only essential activities to continue in order to slow the spread of COVID-19 and flatten the curve. However, a consequence of these NPIs has been that many physicians' offices in the United States were forced to reduce hours, temporarily or permanently close, lay off staff, or suspend in-person visits for telehealth visits. All of these precautions taken by physicians in an effort to minimize the spread of COVID-19 among their patients has subsequently resulted in reduced access to child wellness checkups and vaccination services for people in the United States. As a result, an unknown number of children in the United States have likely missed one or more routine vaccinations since the beginning of the COVID-19 pandemic in March, and are now currently under or unvaccinated. For instance, a morbidity and mortality weekly report from the CDC in May of 2020 shows that there were nationwide declines in orders for VFC-funded ACIP-recommended non-influenza childhood vaccines beginning the week after the United States declared a national emergency. This data can be seen in the charts provided. The VFC program, or Vaccine for Children program, was implemented in 1994 and now provides roughly 50% of children under the age of 19 in the United States with federally purchased vaccines recommended by the Advisory Committee on Immunization Practices, or ACIP. The vaccines recommended by the ACIP protect against 14 potentially severe diseases known as vaccine-preventable diseases, or VPDs. A reduction in VFC-funded, ACIP-recommended non-influenza childhood vaccines is significant because it suggests that vaccination coverage among children in the United States has declined since the beginning of the COVID-19 pandemic. Vaccination is considered one of the greatest public health achievements, contributing to the rise in life expectancy in the United States in the 1900s and recent declines in cases, hospitalizations, death, and healthcare costs associated with vaccine-preventable diseases in the early 20th century. The sharp declines in vaccination coverage reported in the morbidity and mortality weekly reports suggest that many children are at risk of contracting and spreading vaccine-preventable diseases to susceptible individuals in their community who are too young to be vaccinated, cannot be vaccinated because of medical reasons, or who did not develop a sufficient immunological response to vaccination. Any reduction in childhood vaccination coverage is an urgent problem that threatens herd immunity for vulnerable members in our communities and may result in severe outbreaks of vaccine-preventable diseases, as well as increases in hospitalizations, deaths, and healthcare costs associated with vaccine-preventable diseases. It is therefore necessary to evaluate the exact extent in which COVID-19 pandemic has reduced childhood vaccination coverage in the United States. This will enable researchers to estimate the future impact of vaccine-preventable diseases and inform policy recommendations regarding childhood vaccination. Therefore, in the future, my project aims to analyze historical data on disease incidence in childhood vaccination rates in an effort to accurately estimate changes in childhood vaccination coverage since the beginning of the COVID-19 pandemic in the United States. Additionally, I would like to use the data I find regarding childhood vaccination coverage to create models that stimulate the possible impacts of changes in childhood vaccination rates as a consequence of emergencies like the COVID-19 pandemic. Models estimating the future incidence of cases, hospitalizations, and deaths due to vaccine preventable diseases may become a useful tool for informing vaccination policy during national emergencies to prevent severe outbreaks of vaccine preventable diseases. Finally, these models may also be useful in determining the proper allocation of healthcare resources to treat and prevent vaccine preventable diseases and to ensure equitable access to vaccination services among all socioeconomic groups in the United States. I would like to thank the Center for Health and Well-Being under the Global Health and Health Policy Program at Princeton University for funding this preliminary research for my senior thesis. Additionally, I'd like to thank my thesis advisor, Professor Simon Levin, for advising me on this project and connecting me with resources such as Dr. Bruce Gellin at Sabin Vaccine Institute, who also provided me with suggestions regarding my project. Finally, I would like to thank anyone who has taken the time to watch my presentation today.